ovarian cancer.
Thank you very much for the opportunity to present these data, which I shall be presenting later on today. So angiogenesis is a very important factor in tumor cell growth, particularly in ovarian cancer. And the question is really whether oral inhibitors of angiogenesis can usefully prolong disease control and improve survival of recurrent ovarian cancer. And that was the question we set out when we designed the trial. And the drug we used was cediranib, which is a drug that has been developed by AstraZeneca, and it blocks angiogenesis. It's an oral agent, and it has previously been shown to be active in a number of tumor types and also as a single agent in ovarian cancer. So the ICON-6 trial was an international collaboration through the Gynecological Cancer Intergroup, a trial funded by Cancer Research UK and the Medical Research Council, and run through 4 international countries. And it was really the first trial designed to investigate whether an oral VEGF receptor tyrosine kinase inhibitor, which is what this molecule is, combined with chemotherapy and then given as maintenance, can improve the outcome of recurrent ovarian cancer. So the trial design is a little complex, and I'll just walk you through this slowly. It was for patients who were in their first relapse after chemotherapy and surgery. And we know that if patients relapse more than 6 months after their completion of first-line treatment, they will often respond very well to platinum-based chemotherapy, platinum being the most commonly used drug in ovarian cancer. So we took a group of patients who had relapsed more than 6 months from their initial treatment and then randomized them in a 2 to 3 to 3 ratio to either chemotherapy with placebo, that's the chemo alone arm, or chemotherapy with cediranib, that's the concurrent arm, or chemotherapy with cediranib, which was then followed by maintenance cediranib after chemotherapy. The concurrent arm switched, as you can see in the middle, to placebo after the completion of chemotherapy. And the trial drug, whether placebo or cediranib, was continued for 18 months or until progression, although patients who were benefiting beyond 18 months were allowed to continue. And the principal comparison in this trial was between arm A and arm C, as you'll see in the next few slides. So the chemotherapy alone versus the maintenance arm, which is chemotherapy plus cediranib, followed by maintenance cediranib. And these are the results of the primary endpoint, which was the progression-free survival between those 2 arms. And you can see from the 2 curves that there is a significant benefit in terms of progression-free survival in favor of maintenance treatment with cediranib. The hazard ratio here given is 0.57, which is significant on the log rank test. Because the hazards are not proportional, we actually did a restricted means analysis, which is a slightly more complicated way of looking at the difference between the 2 curves. But this too shows an improvement of over 3 months. It was, in fact, a 3.2 month improvement on the restricted means. What are the side effects of this drug? Well, it is an oral drug, and the main problems, like with most of these tyrosine kinase inhibitors, are hypertension, fatigue, diarrhea, and nausea. These are the most common side effects. They were mostly controllable, either with dose reductions or interruptions of chemotherapy, although some patients did need to come off earlier because of toxicity. And certainly the addition of cediranib did not compromise the chemotherapy. Over 80% of the patients were able to receive all 6 cycles of their treatment. And most of the patients continued the maintenance phase until progression. Overall survival was a secondary endpoint in this trial, but here too you can see a significant improvement in favor of the maintenance arm. The data are about 50% mature in terms of the death rate, but you can see that the median improves from 20.3 to 26.3 with a hazard ratio of 0.7. Again, a significant difference. We again have the issue of non-proportionality of the curves, the hazard ratios, and therefore a restricted means analysis was done here, and this showed a 2.7 month difference in survival in favor of the maintenance treatment. So to conclude, cediranib plus platinum-based chemotherapy followed by maintenance cediranib is a statistically significant benefit to chemotherapy alone in recurrent ovarian cancer, with prolongation of the progression-free survival by 3.1 months and the overall survival by 2.7 months. The safety data were consistent with the profile of cediranib that we knew from other studies and could be given as prolonged maintenance therapy. And this is the first trial to demonstrate a significant improvement in both the progression-free survival and overall survival with an oral VEGF receptor tyrosine kinase inhibitor in ovarian cancer. And these results suggest that cediranib has a clinically meaningful role in the treatment of recurrent ovarian cancer. Thank you.
Thank you very much. We'll go on now to our third presentation.